Good afternoon, everyone. We're going to get started in just a minute. Again, just as a reminder, if you would mute your microphone and turn off your camera unless you're one of the speakers. And thank you all so much for being with us today. We'll get started in just a minute. All right, well, good afternoon, everyone, and welcome to today's webinar about the vaccination rates across Northern Kentucky and the implications for employers. I'm Brent Cooper, President and CEO of the Northern Kentucky Chamber. We are pleased to co-host today's important webinar with our friends from Triad and Meet NKY. So thanks to Triad and Meet NKY for doing this jointly with us. We have a terrific panel today of attorneys, public health officials, and vaccine trial leaders that will share their insights and expertise on the challenges employers are facing and provide updates on masking, testing, quarantining, and implications of business travel and best practices for incentivizing employees to get vaccinated. We want to thank ERIGO Employer Solutions for sponsoring today's webinar. And before we begin the program, I do have a few housekeeping items. As I mentioned earlier, please take a moment to make sure your microphone on your computer is muted and your camera's turned off unless you're one of the presenters. Throughout the webinar, we will be taking questions for our presenters via the chat feature. To bring up the chat feature, you just hover your mouse in the middle of the screen and the menu will pop up there, and click on the question bubble icon on the right to the side of the menu to chat the display. Please note we are recording this webinar, so if you have any technical difficulties, the webinar will be available for viewing after the session. Also, you will receive an email with a link to the webinar along with a survey we'd like you to complete. These conversations are critical to our region right now, and so again, thank you so much for joining. Today, we have the pleasure of having Allyson Cook with ERIGO Employer Solutions as our moderator. As CEO, Allyson oversees all aspects of client recruitment and service, operations, and compliance. She brings more than 30 years of experience and legal expertise in working closely with many Northern Kentucky and Greater Cincinnati businesses. Allyson received her Juris Doctorate from the University of Kentucky Cats College of Law and a Bachelor of Business Administration from the University of Kentucky. Prior to joining ERIGO, she served of counsel for Stites and Harbison PLLC in Covington. Her practice focused on commercial finance, employment, healthcare, general business services, and litigation. She routinely advises and counsels women-owned and minority-owned businesses in obtaining various business and governmental certifications and structuring joint ventures and teaming arrangements to maximize business opportunities for our clients. A part of the practice she felt particularly passionate about. Allyson has been a terrific resource for us at the Chamber, and Allyson, thank you so much for participating in this and moderating this, and I will turn it over to you.
Thank you, Brent. First of all, ERIGO is proud to be a sponsor of today's webinar. ERIGO, by the way, is celebrating its 10th year anniversary. For those of you who are not familiar with ERIGO, ERIGO partners with companies to provide human resources, services, and solutions, ranging from payroll services to the provision and administration of medical, dental, vision insurance, long-term and short-term disability insurance, life insurance, and workers' compensation insurance as well. We also provide a 401k plan and assist with the many daily HR tasks necessary to maintain a viable workforce. We hope that you will partner with ERIGO Solutions for your human resources, services, and solutions. Now, we have a great panel with us today to discuss all things vaccination across our region. I'm going to introduce our panel members. I'll first start with Steve Devine, the Interim Director of the Northern Kentucky Health Department. Steve?
Well, hello, and good afternoon to everybody. It's a pleasure to be here. I've been with the Northern Kentucky Health Department now for over 32 years, which is kind of what the last year and a half has felt like, unfortunately. I know everybody feels the same way. But having said that, under normal conditions, I'm the Director of Environmental Health and Safety I am currently serving in the role of interim district director, and for the last 18 months or so, myself and our team have been leading at least the public health response efforts at the local level in relationship to COVID-19. So that's been a full-time job, as you might imagine, and certainly still have some road ahead of us. Firstly, I really want to thank the chamber for this opportunity, but also thank the business members who are part of this presentation, as well as those of you who are watching it. I know that this has been a rough time for everybody at a personal as well as professional level, and certainly businesses have taken a beating throughout the course of this, and I want to acknowledge that and thank you and your staff for everything you've done to this point. Having said that, I guess I want to lay the foundation for where we are right now in terms of COVID-19.
Steve, if I could introduce the other panel members.
Oh my God, I'm so sorry.
That's okay. Quite all right. Our next panel member is Rob Hudson, an attorney with Frost Brown Todd. Rob?
Yes, I'm a member with Frost Brown Todd, and I'm practicing in the labor and employment law group. That's been my field of expertise for the last 30 plus years, and it's nice to be needed. We've certainly been needed over the course of the last, year and 5 months. And it's an honor to be a part of this panel and to assist the chamber on an ongoing basis, volunteering from time to time. And Allyson, thank you for sponsoring. And thank you to ERIGO.
Thanks, Rob. The next panel member is Theresa Nelson, an attorney with Graydon. Theresa?
Thank you. Yes, so I'm a partner and the practice group leader of the labor and employment group at Graydon. I will echo that the last year and a half has been very challenging, very complex. It's presented quite a few challenges, but it's been very interesting. And I think I also have felt very needed, as well as Rob, over the last year and a half. And so I'm very excited to be here today. And hopefully we can answer any questions that people have. And I really appreciate the sponsors as well, Allyson. Thank you for inviting me.
Thank you, Theresa. And lastly, Tim Schroeder, the chairman CEO of CTI. Tim?
Thank you, Allyson. First of all, I really appreciate the invitation to be part of this panel this afternoon, and grateful to Brent and the Chamber for not just supporting today's activities, but all their great work throughout the year and throughout the last 18 months or so during this pandemic. My comments today, Allyson, will primarily be from the perspective that CTI, which is global headquarters in Covington, Kentucky, has been fortunate to be part of more than 40 different research projects involving both COVID vaccines as well as treatments. So give a few comments during the discussion relative to our view of how the research has been conducted and about the results and how that impacts the current vaccination rate. So thank you again, Allyson and ERIGO, for sponsoring today.
Thank you, Tim. All right, now let's get into some questions. Steve, I'm going to start with you. From the perspective of the Northern Kentucky Health Department, can you give us a general update on how our region is related to all things COVID and our region's vaccination rates?
Sure, and obviously I was excited to get the information as I got ahead of myself there. Yeah, I'll be happy to do that. Where we are right now is quite honestly in a spot that I know everybody had hoped not to be in, not too long ago. So I'll talk a little bit about, the status of the cases and what that looks like as far as trends going forward and how that relates to vaccinations. So, right now, as far as Northern Kentucky, our local cases, and keep in mind the stats I'm giving you is for the Northern Kentucky Health Department's jurisdiction, which is Boone, Kenton, Campbell, and Grant counties. Yesterday, we had 277 new cases in one day. Our total active cases for our area currently is 2,627, and we've had a total since the beginning of this pandemic of 503 local deaths. Keep in mind those cases are known cases. So those are people who have actually gone to a provider, been tested, and been confirmed positive does not count, obviously, the folks who have been asymptomatic or not sick enough where they've gone to a provider and been tested. Statewide, obviously, the trend is also heading drastically in the situation where cases are really starting to equal now what we saw heading into really the late fall, early winter of 2020, when we didn't even have vaccine available. The positivity rate as of yesterday was 12.87%, and total cases for just one day yesterday were just under 2,600 new cases, and roughly 25% of those were under the age of 18. Why that's important to give you a little perspective is if you look at local cases, we had 277 yesterday, and just about 6-7 weeks ago, we were right around 12 to 15 new cases a day. Active cases, mentioned over 2,600. About that same time frame, we had about 120 active cases. So obviously a big difference from just a little less than 2 months ago. And the state could say the same thing. A positivity rate that's now at heading toward 13% was actually at around 2%, a little over 2% in that same time frame. So things have really taken off at a very steep curve, almost straight up and down in terms of how many cases are being added on a daily basis and what those totals look like. So that's the trend. Yesterday in the state, we broke the records for daily records for hospitalizations, intensive care unit occupancy, as well as folks on ventilators. That's concerning. It's concerning for a lot of reasons, and in particular for our hospital capacity, which obviously has always been an important part of trying to keep the actual transmission as well as total cases down. We don't want it to adversely affect hospitals' capacity to treat people with COVID, but also it's not just the folks that are positive for COVID that are in condition that necessitates them to be in a hospital. It's of concern. If the hospital, in particular staffing, is limited, it also means that other elective surgeries can't happen or have to be greatly reduced because of capacity strain, having to wait longer to go to the ER. And in some cases, and luckily we're not seeing it to this degree yet locally, but in other parts of the state, as well as other states, there are hospitals that have already hit maximum capacity, and basically you have to wait for somebody to leave the hospital before another person can come in, and that's even with expanded facilities. And a good part of that comes down to staffing as well. It's been a hard road for healthcare workers in general, and for facilities specifically that are taking care of all of us. Vaccination rates. So we need more is the short statement on that. But what the background looks like is in Northern Kentucky, we're doing better than most of the rest of the state in terms of vaccination rates, but it's still not enough. We've got about 60% of our entire population in our 4 counties vaccinated at this point. Keep in mind that Pfizer, Moderna, and Johnson & Johnson were the 3 vaccines that have been available since early on. Pfizer just got its full FDA approval yesterday, so that's good news for lots of reasons. The expectation is that Moderna, as well as J&J, will probably get that same approval not too far out, since they applied just a couple of weeks after Pfizer had for full approval. So that's kind of where it's going right now. But keep in mind that our hospitals regionally, not just St. Elizabeth in Northern Kentucky, but across the river and including Children's Hospital, have seen a drastic increase in terms of hospitalizations related to COVID, and that affects everything else, not just the folks that need COVID treatment. And we also are seeing a much younger group now are requiring hospitalizations with more severe illness. When, if you remember when this started, it was primarily older folks who were taking the biggest hit on this, especially long-term care facilities and similar situations. Those are people who are vaccinated the most. Right now, our 80 and above group is about 85% vaccinated. And really from about the age of 60 on up is where we've got the highest population of folks vaccinated, somewhere generally around 70% or so. But as soon as you start dropping down, and age range is where you start to see much of a diminished vaccination rate, and with, in particular, our late teen and 20-year-olds, 20 to 29, being generally the lowest vaccinated percentage, which is of concern, obviously, because we need everybody to get vaccinated who is able to. And at this point, we really need to see more vaccination to turn things around.
Steve, can I interrupt and ask, how are you working with employers and specific groups to increase those vaccination rates?
Yeah, well, good question. And we have, earlier on, we put out a lot of information to various types of businesses. And I think an important part for folks who are in the business to remember is why it's important to them. Some of those things include having a workforce. I know there's already, everybody's already got staffing shortages as it is. If more of your folks are vaccinated, as well as their family members for that matter, that's less of the people that would be off work, either for their own illness or taking care of family members. Increase your productivity, obviously, to be able to keep your workforce going, and protect your customers. There's depending on what kind of business you are, you have clients coming into your office or your facility, or you might be going to their facilities, or in some cases, you might be going into their homes, providing services. And so it's important for protection of your staff, but also for them. There are businesses who are using incentives, whether that's paid time off, or gift cards, or depending on what kind of business they are, maybe things related to the business itself. There are some businesses that required or mandated a vaccination. Some of those don't have a choice, long-term care facilities, and some of those others, based on requirements here from the federal or the state level. But having said that, I think there's several avenues to encourage your staff to get vaccinated, and setting a good example as being management and doing the same can go a long way.
Great. Well, thank you. Thank you, Steve. Tim, you're my next panel member. And for a question, we've heard that vaccine hesitancy is often based on the absence of full FDA approval and the rapid pace at which vaccines were developed. Can you provide some perspective on the process for the vaccine trials and the messaging that should be articulated regarding the efficacy and safety of the vaccines?
Sure, Allyson. I guess where I'd like to start is, first of all, the Chamber scheduled this, and as Steve mentioned, the Pfizer full approval came through yesterday morning. For some, that was later than hoped, and for others, it was right on schedule, and maybe some wish it had been much earlier. But, if you think about this, we started into the COVID vaccine world in March of 2020, and it really, the initial impetus was largely motivated by several hundred companies looking at their research pipelines and saying, what can we do with our technology to try to, as quickly as possible, develop as safe and as efficacious of a vaccine to try and prevent this COVID spread. Typically, pharmaceutical or biotech companies sometimes take decades to move things through their pipeline, both in a decision-making process and a financial prioritization process, and ultimately in a testing process. So what's happened over the last 16 months or so is a dramatic compression of that whole system. And first of all, the Operation Warp Speed public-private partnership that highlighted about 10 companies and their technologies, I think really accelerated this process dramatically. Some of the first patients vaccinated were in the spring of 2020. And as Steve highlighted, the first ones to initiate their proof of concept studies, and then ultimately their large, and I emphasize very large registration studies, were first Pfizer and Moderna, followed shortly thereafter by J&J and AstraZeneca, and then several others after that. What we started to see is, as early as the summer, when some of the, this is the summer of 2020, is when some of the early data started to appear. It was really striking as to how effective the Pfizer, Moderna, and J&J vaccines were in not only preventing COVID infections, but preventing hospitalizations and mortality. Those initial data had to be proven in a much larger series of studies. And throughout the fall and winter of 2020 and early 21, those studies were conducted around the world. And as I highlighted in my introduction, we were fortunate in Greater Cincinnati, Northern Kentucky, that The University of Cincinnati did a lot of research on Moderna. Cincinnati Children's did a lot of the work around the Pfizer vaccine. CTI was the lead on the J&J vaccines. And one of the things I'd certainly make your viewers and participants today aware of is Greater Cincinnati, Northern Kentucky actually participated in an amazingly positive way. This shouldn't be too surprising because dating all the way back to the polio vaccine research of Albert Sabin more than 50 years ago, that research was headquartered and really initiated in Greater Cincinnati, Northern Kentucky. And once again, the citizens here did some really remarkable things in the way they stepped forward, especially when we had much less knowledge and confidence about the safety of these products. So in fact, the approval yesterday contained a lot of data from the region. I'm also happy to highlight, for instance, on the J&J study, we had an incredibly high percentage of African American and Hispanic participants, much higher than what had been expected or anticipated based on the population numbers. So I think for people that might have questions about, one, is this vaccine or are these vaccines safe? I think the short answer is they're very safe. No series of vaccines has ever been studied more thoroughly in the history of the world, and this includes childhood vaccines as well as adult vaccines. Literally hundreds of millions of people around the globe have received these vaccines. The basis for the approval yesterday was the original group of about 20,000 subjects that have been followed since the very beginning. So every safety event of those subjects has been captured and has been documented, has been analyzed, and it's all part of the FDA approval yesterday. And I think the other thing just to highlight for this group is the emergency use authorization is a relatively new pathway that allows the FDA in times of health crisis to approve products, whether they're drugs or vaccines, at an earlier stage to make them available to the general population earlier than they would. I can tell you from the CTI perspective, being in the middle of this, no shortcuts were taken. What happened is timelines were compressed. Things that typically took years were compressed into weeks to months. We had personal experience at CTI where the FDA reviewers themselves came in person and looked at data on hundreds of patients to make sure that it was accurate and was being reflected completely in the submissions. So I think that whether it's the people on this video call today or just people in the general population, they should certainly take away that these are very, very safe vaccines and very, very efficacious. And as Steve highlighted in his update, when you look at the hospitalizations today and the mortality, it is almost exclusively 98 to 90%, 99% unvaccinated people. So we have a solution at our disposal that now, at least in the case of the first vaccine, is fully approved. And really, there are no, I think, relevant objections at this point as to why somebody would not choose to be vaccinated. But that becomes a personal matter, of course.
You referenced the participation of local folks in your company in the vaccine trial. Can you tell us a little more about how that came to be?
Well, I'll mention a couple examples there, Allyson. Number one is the sponsors, the pharmaceutical companies, actually opened participation up to virtually everyone. We started with elderly subjects and then moved into older adults, then ultimately to younger adults, then to adolescents, and most recently into children. So there really was, at some point in time, everyone was eligible to participate in a vaccine study if they chose to. We had subjects who were immunocompromised. We had subjects that were elderly. We had a strong emphasis on ethnicity in addition to age, because we know from other vaccine research that those are groups that are many times underrepresented in the research and sometimes do not participate in the typical vaccine candidates research programs. And so we wanted to make sure, both locally and regionally and nationally, that we did not fall into that particular challenge. And so I'm really happy to say that we had double the participation rate in the J&J program as far as both the African American population and Hispanic population in the Greater Cincinnati, Northern Kentucky region than the prior studies had shown. So I do think that that's, one, kudos to people for participating. And secondly, there was a tremendous interest on the part of whether it was the African American schools, churches, radio stations, newspapers, social media, and the same thing on the Latino side, where we literally went to the markets and to many of the schools and churches there as well, just to highlight the need for participants. And happy to say that when you look at the results, there is no difference in safety in those populations. So there should be an equal confidence level, irrespective of your age, gender, or race, that these studies have been conducted in those populations and have a similar confidence level.
I'm going off script here a little, but what about the booster vaccination?
So great question. Just like everything that's happened, whether it be in the business world or the medical world over the last 18 months, we continue to learn every day. I think what we know right now is if someone is immunocompromised, for instance, they are a transplant patient receiving immunosuppression, whether they're a cancer patient who's been receiving chemotherapy, or even an elderly person whose immune system may not be fully competent just because of aging. Those are a group that individual organizations like CDC and FDA are recommending a third booster shot to those individuals. Beyond that, what you hear is a second vaccination, which is being studied as we speak and is being discussed. And I suspect Steve and some others may want to make some comments on this when we roll around to some of the questions. But I think based on other vaccinations, for instance, influenza, the annual flu vaccine that we get each year that we offer to the general population, in some ways that vaccine is changed slightly each year because of the variants in the flu or influenza strain. And basically each year we get a shot. We're actually getting a booster from the previous year. There's clearly some leftover protection against last year's influenza from this year's. And so while we don't have all the answers yet, I think when you look at data as recently as last week that came from Israel, if you look at the breakthrough cases right now, these are individuals who were vaccinated in the first quarter of 2021, suggesting that for all of us that receive full vaccinations, we are likely going to need another set of vaccines, whether it's the same one we received before or a different one. That's still under study, and I think the recommendations are not complete at this point, so I don't want to mislead anybody, but certainly it's leading us down the path that this is likely an annual vaccine for the foreseeable future, at least based on the data as it stands today.
Great. Well, thank you.
You're welcome.
Theresa and Rob, you guys are up next. What are the biggest concerns or hesitancies you are seeing from your business clients as it relates to vaccinations?
I think Rob's on mute, so I guess I'll go first. So I think from my client's perspective is they want to understand if they can mandate vaccines, which there's a lot of guidance out there and there's a lot of information that is permissible, but also talking through whether they should. And that is a very individual decision and a very individual evaluation for every business, because with labor shortages, and as Steve alluded to, are you a client-facing type of company? Do you have your employees working remotely? Do they work closely together? Are you going to be negatively impacted from labor shortages or people not being available to build whatever it is that you are constructing and manufacturing? So there's a lot of different considerations of, if you would have, a mass exodus of employees if you mandate it. Or if it's something that it should be required in order to keep your workforce healthy. And they also just have questions of best practices, which I know we're going to talk about in a little bit, but basically also not whether you can, whether you should, but also then how to implement those types of policies the best way for your company. And that's usually the conversation that I've been having with my clients.
Rob?
Yeah, can you hear me now?
Yes.
Yes.
All right. It's a business by business decision in terms of whether to mandate, principally driven by the labor shortage. And, there are other factors, including, if you look at your workforce and you realize, maybe you've polled people, you've talked with people, and you realize that only 40% of your workforce has been vaccinated. And I know that that's actually a thing. There are businesses out there, substantial businesses with very low vaccination rates, trying to get information out to people to help them understand, and including now the FDA approval, which should be helpful, trying to move people's their heads and their hearts about this vaccination, as part of laying the groundwork. So you're trying to avoid mandating the vaccine because you're going to lose people. And another part of this is we're a region in this state and in this country where people are committed to freedom of choice when it comes to how they live their lives and the work they perform, and that's a good thing. But it's not always such a good thing when it comes to a mandatory vaccination. So that a lot of these employers are understandably predicting that, hey, if I have really low vaccination rates and I've already offered incentives, then I'm going to lose people. And they also know their workers. They've talked to folks about why aren't you, why don't you have why aren't you getting vaccinated? And those, while it might not be necessarily a good business practice to ask that question on a broad basis, they understand generally why their people aren't getting vaccinated. And so, the next phase is, looking into further mandates and also looking at items like increasing contributions toward health insurance premiums. I don't think the incentives worked as well as people maybe thought they would. So maybe the stick is going to work a little bit better for some folks. I don't want to sound too harsh about it, but personally, professionally, I'm committed to trying to help, maximize the number of vaccinated individuals, notwithstanding the fact that some of my family members don't want to get vaccinated. So that, there are different viewpoints out there, but if you're operating a business, you want that workforce to be safe and healthy. And this is some low-hanging fruit in terms of how to accomplish that. So I hope we get there.
We've seen major employers and concert venues go public with vaccine mandates. And I know, Rob, you attended a concert last night. Are you seeing this with your clients? And what's your policy advice for those businesses that are considering the mandates?
Well, I'll just be real brief here on mandates. Certain types of businesses, as a good example, would be a business, an accounting firm that has to send its auditors into the field, and those auditors are going into government workplaces to conduct audits. The government workplaces are mandating that everyone who comes through the door be vaccinated. Not all government workplaces, but some. And the prediction is that's going to be more prevalent. Accordingly, that particular employer must implement a mandate for its auditors. And so it's not a one-size-fits-all approach, but instead, you need to understand your business, understand the necessity of vaccinations for your business, and then try to mesh that to the applicable law. And the last point there, except for in a few jurisdictions in the country, the law is not going to prevent the mandate. It's just a question of, are there these factors that move you to take the risk of losing a portion of your workforce in the event of a mandate?
Yeah, and I'd add to that, and I totally agree with everything Rob said, is that, if you decide to go the direction of implementing a mandate, just like, these concert venues, or I think the Ravens, the NFL team, is now requiring that there be vaccinations in order to get into, their stadium. Is the next point on that is going to be that there's
we could have somebody mute there. There we go.
So again, if you go down the direction of implementing a policy that mandates vaccinations, not only will some people voluntarily leave because they just made that personal decision that they will not want to get vaccinated and are not necessarily qualified for any of the exemptions that would come into play, but then the employer has to make the decision of, if the employee just doesn't voluntarily leave and you have made this mandate, you are going to have to separate with those individuals that have chosen not to get that vaccination. So not only do you have to potentially, veer away from the incentives, which, as Rob said, have had some effect, but maybe not, the effects that everyone was looking for. But now you have the stick where you are basically going to be inviting, some portion potentially of your workforce to leave. And if they, just maybe don't want to voluntarily leave, then you have to have the wherewithal and understanding that you will then have to separate with those employees. So I think on a policy level, you just really need to evaluate the pros and cons, weigh the risks and benefits of your individual business, your workforce, and how you would continue operating, because there's lost costs to any employer for having a workforce that's out sick, but also having a workforce shortage. So you have to weigh all of those issues.
Just to add one more point briefly, if you're a unionized employer, it can be tricky.
Yeah.
When you're looking at terminating an employee for a new safety-related rule that you put into effect, it could be up to an arbitrator to determine whether you did the right thing. So again, I know this is frustrating for a lot of the attendees, but these things are determined on a business by business basis, depending on geographic location and certain employer characteristics. The general theme is that mandatory vaccinations legally, on balance, are going to be acceptable, but there are indeed exceptions to the rule.
Great. Thank you both for that discussion. The law does allow for religious and medical exemptions. What are your thoughts on how employers should handle those requests?
So
Go ahead, Theresa.
Okay, I was like, so whenever you're talking about, it's a sincerely held religious belief or a medical exemption, that begins a conversation. Is that, you would then obviously have to speak with your employee, potentially get verification of their religious, what they are claiming is their religious exemption or their medical exemption. And then the employer then gets to engage in an interactive process or a determination of whether their request for an accommodation, which let's just assume you have implemented a mandatory vaccination policy, is whether there is an accommodation that you can create that does not create an undue burden to the employer. And those accommodations can look a variety of different ways. And I know Rob probably has seen this, that you have to wear a mask every day if you're unvaccinated. You have to work from home. You have to get tested every week, and maybe some sort of combination of that. Rob, what have you kind of recommended to your clients about other possibility options of accommodating those requests?
Well, I've had very few clients I work with mandate vaccinations, and they're the ones who are, the process is just starting, and we haven't had these objections. And my general thought and advice is that it's the same advice that applies to every kind of accommodation. The attitude with which the employer approaches the process is key. If you're irritated every time someone asks for an exemption or help on an issue, that's not going to serve you well. So you're going to have a process that's set up maybe in your pre-existing handbook for how to handle accommodation requests. It might be pretty general, but when they come in one by one, address them in good faith, trying to find a solution to the problem. Not every problem is going to have a solution, but the idea is an alternative to vaccination for someone who's not medically fit to be vaccinated. The idea of follow-up testing is something that makes a lot of sense. I suppose there could be some instances when, that it's simply an undue hardship for the employer not to require vaccinations. And that's, I think we're going to see that in the healthcare setting more and more, that and now we see it in long-term care now. So, the idea, how are we going to deal with the idea that a government entity is telling us we have to vaccinate, and yet we know that we have to allow these exemptions? And so we're going to be looking for the agencies to get their act together and help us. But really, it's an attitude thing. I mean, I'd submit to you that even if the law didn't require these sorts of accommodations, it would be appropriate for you to explore them on a case-by-case basis when they come up. And there is one other thing I wanted to mention as I believe we're probably winding down on the legal piece. I really thought when we first had the vaccine, and we were addressing mask issues, and we were removing mask requirements. I really thought that the absence of a mask requirement would be the driving force in workplaces towards employees becoming vaccinated. And now that we have the CDC and others saying that at least it's recommended that vaccinated people mask, and if you parse through the government pronouncements, those recommendations apply on a very broad basis in our workplaces. You look for that they specify the types of businesses, and then you look at it and you say, wow, that's every business. So that's a little bit frustrating, because now I work with several businesses who are maintaining that distinction. If you're vaccinated, you don't have to wear a mask. If you're not vaccinated, you do. I generally support that approach. However, we have to be cognizant of the fact that our government agencies are recommending masks for vaccinated people. That driver is less a part of this equation than it was just a couple of months ago. And with that in mind, whatever you hear today, make sure that you're vigilant and that you update your knowledge, because we're updating our knowledge on a daily basis. We don't have all the answers. We certainly don't know what the case is going to be 2-3 weeks from now even. So we have to stay on it.
Great.
I would definitely agree with that, because I think everything I tell my clients is the only constant in this situation is change and update, because you may make a decision today that you do not want to implement any kind of a vaccination mandate. And we always say, give me a call in a couple of weeks after maybe there's some other development or some change, or we have some other situation that arises, or, OSHA comes out with some new rule, or the CDC comes out with some new rule. And it's always been an ever evolving and developing situation that I think that's what's leading to some frustration for employers, is that a lot of people feel like they're just always catching up. But that's just the nature of this situation right now, is that you are needing to keep updated and advised of the different changes and the different requirements, because the government agencies are not necessarily laying them out as quickly as we would want them to. And they're, like I said, the only constant here is change.
Well, we have a few minutes here before our Q&A session, but anybody have anything further from the panel? Steve, you may want to comment on the booster or possible second vaccination referenced in Mr. Schroeder's discussion.
Sure. So for right now, I'll call it the third shot in the original series for the immunocompromised folks. That is something that is a done deal, and folks will be able to have that offered to them. The booster shot, in terms of for everybody who got vaccinated, and I know right now the general talking points seem to be if you've been vaccinated 8 months ago or longer, but we'll see what the actual guidance on that comes out, at least in our case, when it comes through the state of Kentucky, based on what the federal guidance is. But that looks like it's, again, probably going to be something that I expect is going to be announced maybe as early as late September. But again, that needs some additional approvals before it gets to that point. But I think, the biggest thing right now is twofold. One is we're talking about having a lot of vaccine supply out there right now. So if you haven't been vaccinated, it's as easy as ever to get. You can go pretty much anywhere where there's a medical provider and walk in and get a shot. And for those folks who already have been vaccinated and who are immunocompromised, talk to your medical provider. And it's pretty easy at this point to be able to get those vaccines. And it will be in the future if it looks like everybody's required to get a third shot or a booster shot in that case. It's going to be readily available, so it's just a matter of taking advantage of that. But I agree with, the talking point right now. I think that this whole group would agree on is that the Delta variant, the one that's the dominant one right now as far as COVID, is much more aggressive and making people sicker. And you're seeing that right now played out in the hospitals, as was mentioned earlier, that, 80% or above of the folks who are in the worst shape, hospitalized, especially ICUs, are those who are unvaccinated.
Great. Well, thanks. Anything else before we move on? Great discussion, panel members. Okay, now I would like to introduce Lee Kroom, the President and CEO of Northern Kentucky Triad, who will be engaging in some Q&A from our chat. Lee?
Excellent. Yep, Allyson, thank you so much. Before we jump into the Q&A, Steve, Tim, Rob, Theresa, thanks a bunch for sharing that information. I thought that was really helpful. I jotted down Tim's quote there: "The most thoroughly tested vaccine in history." That's a powerful statement. So thank you for that. I did have one question that came in that I will start with regarding quarantining. What do you think today are the best practices for quarantining if you have somebody in your workplace that is COVID positive?
Sure. So I'll start. Anybody else is welcome to jump in. So right now, if you're positive, technically that's an isolation. That means you have the illness and able to transmit it to others. So right now, that's a required isolation for, and it depends on the situation, but basically 10 days. So if you're test positive, but you don't have symptoms, then you're going to have to be quarantined for 10 days or isolated for 10 days. And assuming that as that time goes on, you hit that 10th day, assuming that you're no longer have a fever and haven't had one for 24 hours, and all your other symptoms are either gone or going away, then in most cases, with some exceptions, you'll be able to go back to work. The quarantine itself means you were exposed to somebody, but you're not positive at this point. Right now, if you're fully vaccinated, which is another advantage to getting vaccinated, if you're fully vaccinated, with minor exceptions in some healthcare settings, you don't have to be quarantined. You just have to monitor for your symptoms. Obviously, if you start to have symptoms, then that changes. But in the meantime, if you're fully vaccinated, you don't have to be quarantined in most instances. If you're not fully vaccinated, then you are going to have to be quarantined. And those quarantines generally are going to be for 10 days, although in some cases you can test out a little bit earlier and get out of quarantine at 7 days, assuming, again, you don't have any symptoms.
Steve, thank you for that. So one of the questions in there, and Rob, maybe if you give a shot at this, just based on what you see in your clients, I'll put you a little bit on the spot here just to mix them around. Any guess on what percentage of employers are already mandating vaccines, and what we're making assumption that will go up as a result of Pfizer's approval yesterday. So what are you seeing currently, and what do you think it will be?
In Northern Kentucky, in my judgment, mandates are extremely low. And I roughly estimate 10 to 20% of the workforce tops, or rather the employer population. And I really hope I'm wrong about that, but I it could change in a month or two. Let's hope it does, right? I know probably most of you are aware that the Dieters firm filed a suit yesterday about mandatory vaccines, challenging an employer's right to do that. And thus far around the country, that hasn't gotten any traction with the courts, and I don't expect that it will here, but I can't read those tea leaves, and it's not my case. I do hope that we don't have a negative legal development in our region that slows us down even further from moving towards full vaccination.
Thank you for that. So one of the comments right there at the end of the session was that, boy, just change we've been living in this world of constant change for the last 18 months. Really two questions. What resources would you recommend as we go out of this webinar that we can look for updated information? And on that topic of where we might find things, Tim, I'm going to ask you, where can we find information that we can share with our workforce or friends that talks about the safety of these vaccines, assuming you're not available every day from 1 to 2 to have this conversation on an ongoing basis? Although we will schedule you for that if you'd like.
I appreciate that. You can certainly find people much more versed than me, but I think, in some ways it depends on the level of information. Just something as simple as yesterday's approval, there's a very short press release issued by the FDA, which talks about what the basis for that approval was. And it's literally about a page and a half, and talks about how they received the original data for the emergency use authorization that was granted in December, about 4 to 6 weeks prior to them approving it, and then talking about what they've done and what they've seen over the last 8 or 9 months. And so could be something as simple as that. Certainly there are some of the highest rigor scientific journals for people who really want to get into the nitty gritty of it. But I think just something as simple as going to the FDA website, the CDC website, probably is more than enough to arm people with what they need, Lee, at this point. And if you don't mind, while I've got the floor, I just wanted to add one comment to Steve's earlier points. I think one thing that's really different in the pandemic, obviously, when you think of now versus a year ago, one, we have a variant which is appears to be much more aggressive. Two, we've got a much higher percentage of the population vaccinated than we do a year ago. But the other thing, in the region and across the U.S., we're in a much better place for testing than we were 1 year ago. And I have to say, especially in Northern Kentucky, Steve, your group has really supported, whether it be Gravity Diagnostics or St. Elizabeth's or many of these others. But I travel quite frequently. In fact, I'm traveling today. I get a test before I leave. I get a test when I come back. You get turnaround time in 4 hours typically. And so I think, as Steve highlighted, if you have any exposure, the points that he made are, I think, really, really relevant to the practices you should follow. But I also think, just like in normal influenza or flu season, if you feel like you don't feel well, you've got a fever, nausea, chills, whatever it happens to be, you stay home until it gets worse, in which case then you see your physician. In this case, I think the ease of testing allows you relatively quickly. And talking to my friends at Gravity, one of the things that they're finding is, there are a lot of symptomatic people that do not have COVID right now, that they have other infections that are just endemic to the world we live in. So I do think that's another point to highlight. The region's done a spectacular job in making easy availability for testing with rapid turnaround time, high level of accuracy, and no cost in most cases to the individuals.
Thank you, Tim.
If I could just, piggyback off Tim real quick, you can go to the sites that he mentioned. You can go to the health department's website, nkyhealth.org, and we've got a lot of local information as well as links to the state website with their information, as well as CDC and others. So you can go to our site. It's kind of a one-stop shop to reach other sources as well.
Yep, thank you. We'll do one more question before that. I'm gonna indulge myself with a moment. I feel very lucky that I get to chat with folks like you on a regular basis and get to learn about the processes. I talked to Tim a couple of weeks ago, and he described for me in detail how, every day the world is testing drugs. And when this pandemic hit, he mentioned earlier how they took the existing technologies and basically all the other drugs were just moved over to the side of the road to clear this highway of testing with priority for these drugs, and how they set up worldwide processes. So they were literally testing and handing off results around the world. You think about as we moved around the sun, the testing and results were moving around the sun to get to that end point. So really have a lot of respect for the work that these folks have done to get us a good, safe thing. And the other thing is, folks in our community trying to make good decisions to keep people safe. And right now my thoughts are going out to Garen Colvin. And it was in the newspaper today that there's going to be a protester at his house. I'll mute my mic real quick because I'm going to say some words you probably don't want to hear. I love our country, and I love that we have freedom to speak our minds. But folks like Garen that are trying to make good decisions and keep us safe, and what they're going through as a result of that, boy, it's a tough thing. So sending out a lot of love and thoughts to Garen and what he and his organization are going through right now. So last question, and then we'll hand it back over. Just a thought about, and Rob, this may come back to you from the legal side. If we mandate this and then family disagrees, what kind of legal act, or an employer the family disagrees, what kind of legal action might an employer be looking at the moment? And you may have touched on it some with that Dieter's comment a moment ago, but just want to come back to that as a level of assurance.
Well, and Theresa, do you have any thoughts on that? If you want to take us out with that or begin to address it?
Sure. I mean, I think that a lot of this is going to be what we've seen over the past year and a half, where there's going to be legal challenges, but they're not necessarily going to get a whole lot of traction because there is a lot of authority that has already been put into place through the CDC. The Equal Employment Opportunity Commission has issued different guidance to employers. allowing them and kind of spelling out, what they can do and how it's appropriate and how it complies with different laws that may be kind of triggered by these different mandates and the different requests. And simply because somebody disagrees or doesn't like an employer's policy does not mean that it's unlawful. But I would say, as with almost anything, anyone can sue anyone, and they may not ultimately prevail, and it will have to be defended. And I agree with Rob 100% that I'm really hoping that any legal challenges don't provide this area in this region with any bad law that we then ultimately have to deal with. But I think ultimately it could be a lot of smoke and mirrors, and a lot of people, saying they're going to file something, and there's really not going to be a whole lot of muscle behind it that's going to actually stick.
Yeah, I just add that, still in this country and certainly in our Commonwealth, with every employment law issue, we begin from the position that we have the management right as a business owner, as a business, to do what we think is right within our management discretion. And if we start with that bent as we approach these issues, unless and until someone tells us it's wrong, and so far they're mostly not, then we should proceed with what we think is best. And in this case, hopefully vaccinations.
Well, very good. We could take questions all afternoon. Let me turn it over now to another great community leader that we're blessed to get to work with. Nobody's organization has taken the last 18 months harder. President and CEO of Meet NKY, Julie Kirkpatrick. Julie, you want to take us home here?
I will. Thank you, Lee. And gosh, thank you so much, Steve, Tim, Theresa, and Rob. What a great webinar today. I think there's a lot of questions still out there, and we're all going to keep talking. And I definitely want to say a special thanks to ERIGO for sponsoring today's event. Happy anniversary, Allyson, to the organization. For a deeper dive into today's topic and other labor-related issues, be sure to join us on September the 15th for our annual HR 100 Labor Law Update. This webinar, featuring DBL Law partners Nick Birkenhauer and Katie Tranner, will focus on a variety of important legal issues in the workplace. Attendees will receive SHRM credit for this event, and organizational leaders will also want to mark their calendars for an all-day HR strategic six-pack on November the 10th at Receptions Banquet and Conference Center. This event will earn attendees 6 strategic SHRM credits and feature 6 outstanding national and regional experts covering relevant strategic alignment, HR leadership, diversity, equity, and inclusion topics, and you can register for the early bird rate of $75 until September the 10th. And if you want to register, please visit the Northern Kentucky Chamber website at nkychamber.com/events. And finally, Brent, Lee, myself, and all of our organizations are committed that good health is good business, and we are going to do what we can to provide businesses and individuals with the information and tools they need to reduce the spread of COVID-19 and increase the rate of vaccinated individuals in our region. So having experts like these today answer questions and provide facts enable businesses to make more informed decisions and help our community get better and build back stronger. So on behalf of NKY Chamber, Triad, and Meet NKY, thank you all so much for joining us today. So I hope that you have a great day and have a smart and safe rest of your week. Thank you all.